What makes a successful career for an obstetrician-gynecologist? Stressful as it is, how can we enjoy such specialty? After some time, the stress takes out the joy and simply we feel stuck. 2018. I was asked this question in a conference when I was giving a presentation titled Improving Medical Practice. My answer was confidence. You see, confidence in that you are taking the correct decision. Confidence that you can handle the situation. That confidence just shines out of you and everyone feels it. The patient, her relatives, the medical staff, most important you feel it and you enjoy your practice. My colleague followed with another question. How can I be confident? I answered, with adequate knowledge you are confident. Again, he continued, what do you mean with adequate knowledge? We read literally all the time and still do not feel that confidence, and we do not enjoy our practice. I answered patiently, well, the objective of knowledge is decision making. The ability to take sound decisions is the definition of a competent physician. Many of what you read focuses on information rather than decision. You have to be actively extracting decisions from the information you read. He followed with a very important question. How do I know that my knowledge is adequate? I answered, first, knowledge must be evidence based on guideline, not published literature or journal articles. Second, the two arms of knowledge are information and decision. Both must be adequate. Adequate information is when you know the basic sciences and rationale behind any decision you take, to diagnose or treat a patient. This is your left arm. You will know this arm is powered with adequate knowledge when you are not confused with why we do this and why we do not do that. Adequate decision is when you can take clear-cut, firm, and timely decision. This is your right arm, the main arm you use for diagnosis and treatment. You will know this arm is powered with adequate knowledge when you infrequently use the term or. It is very rare to use or, because every decision, whether for diagnosis or treatment, has an indication. Using or simply means lack of knowledge regarding when to do what. He continued, how can we get there? Sir, you are talking about a miserable lifetime spent between 80 or 90 different textbooks to get to that point of adequate knowledge. I was speechless. He is right. Then an idea came to my mind, so I answered, a project to provide you with adequate knowledge, from one source, will be launched. And in few years you will have a textbook of obstetrics and gynecology that will be based on the well-established internet video explained lectures. On that day TOGIVEL project started. 2021 was the release of the first edition of TOGIVEL, with one objective in mind. TOGIVEL should be crafted to provide you with evidence-based adequate knowledge from just one source. 2024 marks the release of this special third edition. Special in that it is refined to include all the feedbacks from previous editions. The content is optimized for easy understanding and recall. Many topics and algorithms reformed. Guidelines updated and upgraded with addition of new topics. You can check TOGIVEL with online full access for 14 days. Fall in love again with obstetrics and gynecology specialty. To get your 14-day free trial, go to togivel.com. Click on TOGIVEL Online 14-day free trial. If TOGIVEL provides you with exactly what you need, then you can proceed to possess your copy of TOGIVEL, whether hard copy, or online copy, or even both. I hope TOGIVEL makes the mission of success in your career, whether to obtain specialty degrees, or competence in clinical practice, easier and more enjoyable.